So I am Dr. Prashant R. Reddy. I am a ENT surgeon who also deals with specifically in the nose and also with the snoring. So I specialize in taking care of patients who are having snoring, and I cure them of their snoring. There are two aspects for the treatment of sleep apnea. One is the conventional non-surgical aspect, other one is a surgical aspect. So in the non-surgical aspect, again we can divide it into the regular things like the chin strap which people wear to keep the mouth locked. But unfortunately, if the tongue is very big and they are not able to breathe through the nose, that is the worst thing which they can do. Second one is nasal dilators. They have those nasal bands which they put on top of the nose, or they have those plugs which they put it into the nose so that they can breathe better. That also is limited because the main obstruction is behind the nose and they can't actually take care of it with an external band or a thing inside. Third one, which many pulmonologists advise, is a CPAP, constant airway pressure machine. So that machine is a device which you put it onto your face like a face mask and then strap it fully around your head and neck and then go to sleep. This is useful for patients who don't have any nose blocks, because the air has to go through the nose behind the soft palate and come to the trachea and go into the lungs. But if there is any kind of an obstruction in the upper airway, be it the nose, back of the nose, or the oropharynx, that device unfortunately will increase the pressure, which is not good for your lungs per se as such, because over a certain amount of pressure, if the amount of pressure which is required to push the tongue forward, it will be extremely high, and that will lead to more amount of damage to the lungs. So these are the non-surgical part. And the lifestyle changes is something which I had missed out on. Lifestyle changes include weight loss, sleeping properly in an inclined position such that the blood flow is better, and exercising properly, and having a healthy diet. These are things to ensure that you get proper sleep and you reduce your weight and the inflammation inside your body is better. Coming to the surgical aspect, so as I mentioned, there are 4 to 5 different phases of obstruction. One is the nose, one is the back of the nose, nasopharynx, third is the throat, the oral cavity, and the fourth one is lower part of the throat. So this let us come in phases. The primary issue of the snoring is because of nose obstruction. So for the nose, we'll have to assess the nose, check what exactly are the symptoms, what are the issues inside the nose. If it's the bone which is bent or the septum which is bent, that has to be corrected. If there are sinuses which are causing issue leading to blocks, that has to be removed. If there are turbinates are folds inside the nose which are required for airflow. If they are uneven and they are causing obstruction, that has to be reduced. Fourth is back of the nose, nasopharynx area. So in that area, there'll be a collapse of the wall from the sideways, lateral wall, pharyngeal wall collapse, or there'll be adenoid tissues. Adenoid tissues are something which are seen in kids. You would have heard of people say in the third tonsil, which is in the back of the nose. That will be enlarged and they can't breathe through the nose. Everything will be fine in the nose, but the adenoid is the obstruction, and that will lead to mouth breathing and snoring. So that has to be addressed and removed. Coming to the throat, if there are tonsils which are pretty big and bulky, that is causing an obstruction for the air to go in through your mouth. That also leads to that has to be removed. That leads to your snoring. Then the bulky tongue, because of nose obstruction, the tongue can get bulky because of excessive blood flow. To reduce the dryness, that tongue can be reduced, but that part I'll come to the last part, because that is the last stage. If that has to be addressed. The palate work, if it is extremely long, so usually palate will be this much, but for people who are snoring it will be this long. So that has to be corrected. So this is called a uvuloplasty or a zeta pharyngoplasty, where we reduce the palate size, we bulk up the palate, and that will improve the snoring vibration. The vibration will reduce, and also the airway in the back of the nose, the nasopharynx, that will be pulled forward, so they can breathe much more better through the nose. Coming to the tongue now. So when the tongue is extremely bulky, what we do is something called as a genioplasty, where we go inside the lip, we'll cut open a piece of bone here, the mandible, we'll pull the bone forward and turn it and suture it back. So what happens with this, the tongue gets pulled forward, the base of the tongue, the bulky tongue will get pulled forward, that will reduce. There are surgeons who do the median wedge resection, wherein the tongue is cut in the center, the back side, and reduced. But that unfortunately leads to a lot of complications, because it leads to a lot of bleeding, infection, and the ability to talk, swallow, everything will get worsened. The other thing which can be done is a maxillomandibular advancement, wherein this is again, the snoring surgeries are usually stage surgeries. We take care of the nose, we take care of the palate, we take care of the tonsils, we take care of the nasopharynx. That is stage 1. In case patients have still not improved with the symptoms, then we go for stage 2, where we do the genioplasty, we do the maxillomandibular advancement, where we pull the mandible forward, maxilla forward. And the 4th stage is hyoidoplexy, where we use, there's a bone called hyoid bone which is here, and we do a thyrohyoidoplexy, wherein the cartilage from the larynx, the voice box, is connected to this, and the space is widened up in the area here, in case there is an obstruction way below. So these are the surgical interventions which we do, and all of these are scar free because of pain for about 2 weeks max. So beyond that, there won't be any problem. They can walk around, they can do their works normally, they can breathe better. In fact, they'll be sleeping much more better. Yeah, one complication is they'll have to change their wardrobe, because they'll keep losing weight, and all their pants and shirts will be extremely big. So that's why they have to change the wardrobe. That's the complication which I would tell my patients. Yes, that's the complication financially though. So if they avoid the surgery, the complications of snoring are, again, as I mentioned initially, the daytime sleepiness. So what in case the patient, I've had patients who actually have dozed off while riding two-wheelers and have met with accidents. So the fatality is extremely high because of that. They'll be driving their loved ones in the car and they fall to sleep. So it's not just a risk for them, it's a risk of the family members also, not just family members, and also the outside other commuters who are there on the road. That's a risk. And also you have heard of a lot of these sudden deaths which are occurring. All those patients also do have a component of sleep apnea. So that has to be corrected and addressed. And patients who have snoring have a very high chance of developing diabetes and hypertension. Second to diabetes and hypertension, their heart going for failure is high, because as I mentioned initially, that because of snoring, that leads to an extreme amount of pressure on the heart. So that leads to cardiac failure. Second to cardiac failure, you will have other complications. And also because of the inflammatory mediators, because the inflammatory mediators are extremely high in the body and the blood of the patients, they will have issues of the retinal detachments and the liver going for failure, the kidney going for failure. There is a very high chance of patients developing strokes. When I say stroke, brain stroke, they can go in for paralysis and other issues. So these are the complications associated with snoring, patients who have got long-term snoring. Many patients will say, I don't have diabetes, I don't have this, I don't have hypertension as of now. But that's only now. They would have started snoring and they don't have it right now. After 2-3 years, they are definitely going to have. And there are also chances of patients having insomnia, patients having muscle cramps, patients having daytime headaches. When they wake up in the morning, they'll have a headache. And also they don't wake up early in the morning because they don't have proper sleep. Even though they are in the bed for more than 6 to 7 hours, they don't get a good sleep, because the sleep and depth of sleep is very, very important, and that depth of sleep is not achieved by them. It's a very, very shallow sleep which they have. So these are the complications. And also patients who have all this sleep deprivation, they will develop depression, anxiety and insomnia and other psychological issues. Sort of questions or queries related to sleep apnea, do type into the comments such that we can get back to you accordingly.